Hi, I'm Tom Ribeiro. I'm professor of medicine at School of Medicine of Federal University of Minas Gerais, and also the head of innovation and research at University Hospital. We have been working with telehealth in order to try to solve a difficult situation in our country. As you all know, Brazil is a large country with several small municipalities in which persons have access to primary health care facilities and doctors in most of these places, but they do not have access to specialized exams. So if they need to perform an ECG or an echo study or any other more sophisticated exams, they need to move to larger cities to be evaluated by specialists or to perform these exams. This is a situation that's very difficult to solve because although we have a very good national health system, it's a very large country, this system is underfunded, so we would need more money to provide health assistance of quality to all. And we also know that this distance sometimes are very long. People have to travel for several hours to reach these large cities. So we have this challenge of providing access to medical exams to people living in remote places in a very large country, a country with more than 200 million persons. And we try to solve this issue, to help to solve this issue, creating a telehealth network. We began in the state of Minas Gerais, so in the southeast part of the country, and it was called a Telehealth Network of Minas Gerais because with the support of the State of Minas Gerais Health Department, we developed this telehealth network in which we established a telehealth remote point in almost all small municipalities. There are 800 municipalities in this state. In all these places we have an ECG machine and ECG machine connected to a computer, and we developed a system in which we acquire the ECG signal in all these places, and it's uploaded to a central station that is this place in which we receive these ECGs every day, and we are receiving almost 3,000 ECGs every day. And we have cardiologists that are in remote points. They are in their own office or homes or hospitals, and we have a system that it's a web-based system that allows them to interpret, to analyze, and to give a report for all these ECGs. So we developed several versions of this system, and now it's running a version that we are able to give a report of an urgent exam in 5 minutes, and also those that are not urgent are being reported in 30 minutes. So our urgent exams are being reported in less than 10 minutes, and our exams are being reported in less than 2 hours. We control this in real time, so we can see that the number of the exams are being received by the server, the central server in orange, in green, the exams in orange, how many ECGs are being analyzed by the cardiologist. So we have a very small waiting list for this, and we are working 24 hours a day. So during the night we can receive the urgent cases from urgent health units, and these systems can help a lot the physician in remote places to have an ECG that is being analyzed by a cardiologist and can help how to take care of these patients. If they have doubts in how to conduct the case for these patients, they can call a number, and the cardiologist on duty will answer his or her questions and can help both the interpretation of the exam and how to proceed in those urgent cases. We receive a big number of urgent cases every day. You can see that we have 22 cases in which immediate clinical situation, urgent clinical situation was detected, and something has to be done very, very quickly. What would be the next challenges for us? We are present now in 8 states of our country, so even in the Amazonian region, the northeast, the center-west, and the southeast region. We intend to expand to other places and to provide some kind of universal service for our public health system. And this is a challenge because Brazil is very large. There is more than 5,000 municipalities, and it will be a very large scale service, and how to scale up is a big challenge. Another challenge is to provide other exams in the same way. So we are performing Holter monitoring, we are performing retinal fundoscopy photography, and other exams, but we would need to invest in other fields and try to solve the same problem that we have for cardiovascular disease, for pneumology, for dermatology, and other fields. And we need to maintain a sustainable service. By now, we use some kind of funds from the government that are renewed from year to year or every 2 years, and there are some instability on how to maintain this service working. But indeed, we consider that the telehealth is a very important tool to provide access to health and access of health with quality for the Brazilian population. Thank you.